Everybody, we have Dr. AJ Goldberg from Saugus, Massachusetts, close to Boston, one of my great longtime chiropractic friends and colleagues. He's been a chiropractor for over 5 years, 29 years old. Imagine that for all you people out there who are young chiropractors or older chiropractors, or like me, I'm 33. I'm still in chiropractic school. Imagine what it would be like to be a second generation chiropractor and starting with purpose at 23 or 24 years old. Dr. AJ got an incredible story. And today we are going to talk about how chiropractic is really about staying healthy.
Well, thanks for having me, Dalton. I'm very excited to be here. So as I actually graduated when I was 23, I started practice when I was 23, then been in practice for over 5 years now, and I just turned 29. And for been loving what I've been doing for the last 5 years, as I was born into it and knew it was my purpose my entire life since I've been going through everything.
Yeah. Well, so you had a chiropractic father who was amazing, right?
Yes.
And so you said you always knew you wanted to be a chiropractor, but do you remember like the first time you were like, man, Dad, this is so cool. What is this?
Well, I believe it or not, I said I was going to be a chiropractor since second grade.
Yeah.
So, yes. So, as that puts me around, I believe like around 10, 12 years old.
Okay.
So I was going to be a chiropractor. And then kind of followed through, and here I am.
Yeah, man.
20 years later.
What was it at 10 or 12 years old that you were being adjusted since you were a baby, right?
Yes. So I was adjusted first day I was alive, adjusted my entire life as I've been adjusted. Like I said, my entire life, it's all I've known. I said I was going to be a chiropractor because his one father was a role model of mine. Always was very close with him as well. I always got to see how he lived his life, where he got to enjoy it. He got to help people all the time. And he lived a pretty good life. So I was really close with him. He's a role model of mine. And I just wanted to be like him.
Yeah. What did you see? Did you ever do like a go to dad with work day?
Sure. Well, I actually grew up in the office. So as my father had a family practice, there's a lot of families. I actually was hanging out in the office. My mother was the office manager. I also was, there was a kids room. We did a lot of families. So I was always hanging out in the kids room, as well as I grew up in the office. So I always got to see how friendly everyone was. Everyone was always happy to be there, and everyone was always excited. Chiropractic was always positive in my life, and just figured like, hey, that seems like a pretty good way to spend your day.
Right. Helping people. Everybody's walking in happy and out happy.
Right. Exactly. Yeah.
It's pretty good. Yeah, dude. Well, hey, you were just, we were talking back and forth, talking about, okay, well, what would be an incredible topic to cover today? How chiropractic, and you said you wanted to talk about how chiropractic is really about staying healthy. Of all people, you grew up doing martial arts. You're still an active dude. Look at you, chiropractic. Look at the nervous system. What a beautiful body and beautiful face. Strong heart, high functioning brain. Come on. What do you want to start with? What do you want people to know about how you're using chiropractic to stay healthy?
Sure. Well, thank you for all that. And I think it really starts with my story and how it was raised. And before I actually understood the science and then the newest research coming out to understand the philosophy of chiropractic, I think starting with my story of how I was raised with it is really gives my perspective of my view on chiropractic as well.
Yeah.
So the whole story is I was raised with chiropractic and just like you were sharing is as an more active individual, I was an energetic and rambunctious kid.
Yeah.
That would run around. Would run around and to jump into things, run into walls, fall off stuff.
Yeah, totally.
Yeah. Play sports, all the good things, right? The and had a lot of fun. And then the other thing too, so is what I noticed is just like very active, very like normal kid. But then also is I was different than most other kids as well, because what I noticed was all these things I would fall off or something would happen, or if I was getting sick, which wasn't very often, but say there's like I was getting a cold or something, I'd go to my father, I get adjusted, and then I go to bed. I wake up feeling great. So
Yeah.
whatever's going on is like, yeah, what we do is go to chiropractor, get adjusted. Happened. My father was a chiropractor, helped out, so I could get adjusted whenever. And then it's like, hey, let the body heal itself and reset. And then as a kid, right, it responds quick, and I woke up feeling great all the time. It's awesome. Whenever I run into something or have an injury.
Yeah.
So what I noticed was that was the way I was raised, and that was just normal in my household. But what was different was my friends were, when they had injuries or something, it would last forever. And it was very confusing for me because it wasn't just getting better overnight, like I feel like it should have been, because that was normal for me and my family. And then, as well as like it would last for multiple days, whatever they're dealing with, sometimes like a week or so, a couple weeks. It was just confusing for me
Yeah.
because that was just not normal in my household. And then what I also learned and started figuring out was none of those kids were getting adjusted as well. So like I thought everyone's getting adjusted.
Yeah.
Like I said,
It's like,
that
hey,
was just the way it is. Yeah.
well, what a good thing. Hey, that doesn't even make sense. Why would you not get adjusted?
It was so confusing for me. That was just so
Yeah.
normal for me. And then also is what I started to learn as well is like most people didn't understand that we were getting adjusted to be preventative as well and stay healthy. Like it wasn't like, we weren't just getting adjusted when it was injuries. It's like it was a lifestyle, and I was getting adjusted all the time. Either there's something good or wrong, where it was much more preventative, and that was just the way we were raised. And then I found out none of them were getting adjusted, and not a lot of people understood the true value of chiropractic, of how we were applying it as well.
Yeah. Right.
Mhm.
Right. So you noticed as you're a kid that everybody's, they can't recover as well. I mean, I feel like you probably see this in practice all the time too, is that kids respond so well to chiropractic. Like their little
Right.
nervous systems are just like you said, they're bouncing off the walls, jumping off of things, doing backflips, burning stuff.
Sure, absolutely. Well, we have a
Yeah.
saying, right? We have a saying in the office, it's easier to keep a kid healthy rather than fix a broken adult.
Yeah. True.
Because when, like you said, kids respond fast, and they actually are able to, if there is something, or you get to the body right away, give the chance to the body to heal, make sure there's no interruption in the nervous system to let the body heal. And yeah, kids respond really quick. So that was just the way I was raised, and something would happen. Is this chiropractic was always positive for me in my life as well. And that's just when I thought of how I want to spend my days, that was how I was thinking about it.
Yeah. Well, dude, that's a great way to do it. I mean,
Mm-hmm.
and then so you went into your undergraduate right out of high school?
Yes. So what ended up happening was pretty quick. I found out early on I want to be a chiropractor. So actually in seventh grade, I said I was going to set out to go to school in California and become a chiropractor.
Why?
So that was because it was awesome.
Yeah, yeah. Had you been before, or you were just like, no, I know that's the place to be?
I was actually in vacation out in California with my father, and it was just a beautiful day. It was palm trees. There was no cloud in the sky, sunny 80-degree weather, as Southern California is. And he just mentioned there was a chiropractic school out there, and that's what I set out to go do.
You're
I
like,
was like, hey, I'm just going to go here.
yeah, 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 yeah.
That's
I don't
pretty
need to
much
think
it.
about this any longer. Done. Yeah, yeah.
Yeah, it was a beautiful day. It was like, couldn't sell me any easier. So
Yeah.
there wasn't a school in Massachusetts. The closest school is New York. So is it like New York, cold winters, or sunny California?
Hey, I pick sunny California any day of the week.
Sure.
Yeah.
So that was my overall goal. And there was actually that's what I was starting to learn, was that's what I wanted to do, was when it came to how I want to spend my days and time. It was rather keep people healthy all day. So now is when it came to what do I got to do to get back to become a chiropractor? Well, now it's all right. Well, for lack of better terms, how do I get the degree so I can get to practice right away? And that
Right.
was just me finding out the quickest route so that way I can get to chiropractic school and then get to practice and start helping families right away.
Sure. Sure. So then,
So,
did you do like a fast track on your undergrad and into biology?
sure. Well, I started in community college because I wanted to go the cheaper route. What I thought was going to be 4 years. So the first 2 years I went to a local junior college, and when I was in class, I actually did some research and found out that one of the rules for practicing chiropractic in Massachusetts, where I wanted to practice, you didn't need a bachelor's degree. And
Oh,
I
okay.
just happened to, I wanted to look into what do I need to do to actually get into chiropractic school and practice to make sure I was doing all the right things.
Right.
And upon my research, I found out was you didn't need a bachelor's degree, and then to get into chiropractic school, you need you need 90 credits and not a bachelor's degree and a certain amount of health science credits,
Right.
which is actually, when you do the math, is a standard 3 years of school and taking a health science class every semester.
Right.
Like that'd be anatomy, biology, physiology. But you,
Sure.
to meet the requirements, when I did all the figuring out, it was one health science every semester, then a 3 years of school to get into chiropractic school, then to get into chiropractic school. I didn't need a bachelor's degree, and then I didn't need a bachelor's degree to practice in the state of Massachusetts, where I knew I wanted to end up. So I did the 3 years of school in 2 years,
Nice.
at the junior college.
Right.
So instead of doing 4 years, I did 2 years, but 3 years of school and met all the requirements, did everything I needed to do, did full summer courses, and got into chiropractic school in 2 years after high school instead of four.
Right. Right. Well, dude, so here's the deal. You're super ambitious and you're like, all right, well, I got to get this done quick and I want to get into go practice with your dad, right? I mean, that was the plan.
Exactly. Yeah, that was the ultimate goal. So that's what I set out to do, was went out to California. And then from there was able to fast track that instead of the 4 year route, was able to do the accelerated program, which was 3 years.
Nice.
Yeah.
So then
Yes.
fast forward to all throughout school, this is where we met. We met when you were in school still.
Yes. Yes.
Yeah.
So I was still in school when we met.
Right.
We were going to seminars, and that's when we actually met.
I know. I
Um,
know.
It's
Met me
just
with
funny
long
because that's
hair and a beard and striped pants, you know?
right,
You
right.
met the rock and
Full
roller
beard.
Dalton. Yeah, 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 totally.
That's
So that's
funny.
okay. There you go.
Yeah.
And
So yeah,
yeah,
so that's what I did. Went to school in California, and then is that was the ultimate goal, was to finish in 3 years, then come back to practice with my father, and then ultimately help families stay healthy. And that was our ultimate goal.
right, right,
Hmm.
right. So then, you're out the end of chiropractic school and your story. You
Hmm.
give us a little like snapshot of your story. We don't have to make the whole podcast about it if you don't want to, but it's an integral part of how everything
Absolutely.
projected for you from there.
Well, my story gives me a lot of purpose. So, like we mentioned, Dalton, we've been friends for a long time. Dalton actually was part of my life going through it as well. So, 2 months before I graduated, my father, he actually ended up passing away. So that was the tragedy in the story, is I never got an opportunity to practice with my father. Is I was about to graduate, unfortunately, is 7 years prior to the death, is we were actually martial artists, and he was training one time and he got kicked in the wrist and he broke his wrist. So he had to have surgery. He did all the physical therapy, he did all the rehab, but he still had a lot of pain in his wrist. And when it came to practice, he had two decisions to make for the last 5 years, of the last 5 years of his career. And it was either retire and go on disability or continue his purpose. And his purpose was bigger than his pain. every day was going into the office to help families and keep them healthy and be treating patients all day. But a lot of people didn't know how much pain he was in with all the treatments he was providing all day.
Right.
And the only way he knew how to continue his purpose along that journey, he was taking the painkillers and the opioids he got originally from his wrist surgery,
Mm-hmm.
which eventually led to his heart stopping right when I was about to graduate. So it was it started with a problem where he had surgery and medicine didn't help him, and then he had all the rehab, all the physical therapy, and there's nothing else they could do for him. So he had to figure out how he can continue helping people, and which ultimately taken his life.
Yeah. Yeah. So, I mean, it was massive upset. I mean, when this happened, you essentially were, most people in this situation, you could have reacted in a bunch of different ways, right? What I remember, and you may have something different because you're you, and I just saw from the outside, but from my perspective, you were just like, on top of mourning the death of your father, you were like, all right, well, I have to do this because there's a practice that is waiting. There are people who are looking to be taken care of. My dad used to take care of them. Now I got to get my shit together. And you were, hey man, you were dialed in, brother. Like you were with Fred. I mean, practicing everything that you needed to learn, and make it unconscious competence of how to communicate with people and keep things running,
Sure,
Yeah.
sure. Which wasn't easy, and there was a journey for the first couple of years, but is over through a lot of, for lack of better words, ambition and trials and tribulations. Is here we are, 5 years later, still enjoying it with the purpose of having a lot of fun in the office every day.
Yeah, man. I mean, well, now, I mean, it's cool because now you've got so much time under your belt, owning a clinic.
Sure.
Yeah,
Yes, which comes with a
it's
whole
like
new life.
I know, bro. I mean, like the amount of people that I talk to about chiropractic, like people don't just step into the entrepreneurial role of chiropractic. This is what's also amazing about you is that not only were you learning how to be clinically relevant to a patient who's looking to be healthy, but also you jumped into running a business that was already running.
Sure,
That's not
absolutely.
easy. That's not easy. It's not easy to
No,
start a business, let alone like carry on something that, not to say that you weren't familiar with it because you grew up in it, but I mean, absolutely there are aspects of running a business that I'm sure, were unaware of until, maybe even you're still finding out stuff.
I found some stuff out last week. I just had to have a lesson last
Yeah,
night. What are you talking about? And I was like, oh,
yeah,
that's new. All right,
yeah,
cool.
yeah, totally.
So is yes, is then is it helps to be, like you said, is a little bit more ambitious. That was always something too, that was just me, who I am. But also to come into that and, like you said, is not only go into a business that had a certain expectation, but what my father and I were planning wasn't for me just to do what he was doing in the office already. Like, fortunate for me, I grew up in that, and that was kind of my baseline already. He wanted me to go to chiropractic school to make sure I could add to what we were already doing in the office to get people healthier and like add better to what we could do, but make sure our approach was evolving, as well as I went to school and learned the latest research and
Right,
technologies as well.
right,
So that comes with a whole new um, set of problems, is how I'll put it. When patients have one set of expectation, I'm coming in and evolving the office to add to it to ultimately get better results, but is different for most people and kind of changing their expectations of what they want as well.
right.
When it comes to business, that means, what's that mean? A lot of patients not starting or continuing once I got there as well.
Right, right.
That's what that translates to.
Yeah.
Yeah. They didn't want change, so I wanted to change it. They didn't. I wanted to add to it. They didn't like change, so is over time had to use that ambitious spirit of mine to kind of make the practice mine, change the office a lot, and through a lot of different evolutions to ultimately become where it's added to what ultimately started with making it a community resource for health and wellness.
Right.
Like that was the ultimate goal, and how can we add to that as I was going to school to evolve it.
Right. Right. And here's the thing, like I'm curious because most people start out being an associate somewhere. Most doctors, that's typically their path. So, although that wasn't your path, do you feel like if you imagine yourself being an associate somewhere, would you still pick to just start being your own business owner? Or would you have picked to go, oh, maybe it would have been nice to shadow somebody for a couple of years?
Both have pros and cons.
Yeah.
It really depends what you want. I kind of had that my whole life of just being in there, just never in the driver's seat. So I was always raised in it. And being close to my father, I was always having these lessons on everything almost every weekend with him. But the point is I didn't have a choice. And I think my personality, I do better with just kind of getting thrown in the fire.
Yeah.
So that is like, if you want to say where do I just kind of lock in and do my thing, is when life happens like that.
There's pressure. Yeah.
Sure, yeah, I guess so.
Yeah.
except for sports, can't do
Are
well in
you a
sports.
diamond?
So
Are you a diamond? Hold on a second.
in
I
the
think
rough, very
you're a
rough.
diamond. You're a diamond.
Could be, yes.
Exactly.
But so, anyways, is I think I do better with getting thrown in the fire. But I see me going through the trials and tribulations of learning on the job. I can also appreciate having a little bit more time to evolve as well. Also, starting so young.
Yeah. Yeah. Well, dude, I mean,
Yeah.
you're really skipping like so many years, really. I mean, even though it may have been a rough start compared to where you're at now, but I mean, having that rough start, you maybe saved yourself a decade's worth of like just trial and error. You know what I mean?
Sure.
Yeah.
Or
Yeah.
added a decade on the other half of trial and error of being like, oh, I messed that part up.
Uh,
So another thing I think of too, right, is sometimes you have a mentor that shortcuts a lot of stuff for you as well. Like even when it comes to clinically as well, is I have mentors, but also is when you don't have someone in the office with you to learn how to help people, because that's a new art that you don't learn in chiropractic school, but actually to be the sole provider to help people and get clinical results of what everyone's looking for. Me as the chiropractor, them as the patient, what do they want as well? What are their goals? Like to actually get to that, that's an art and actually a new technique that you also have to learn, that having a mentor in the office probably shortcuts that and saves a lot of time and trials of being like, ooh, messed that one up. Ooh, okay, now I know what to do for that one.
Right. Right.
Yeah. That's why that I learned very quickly. That's why when it comes to helping people and being in healthcare, they call it practice.
Yeah.
It's not perfect because you're in practice.
Yeah. Yeah.
You're always practicing.
Yeah. That's funny. True, brother. True.
Yeah. So
Tell
I
us.
think having a mentor that way also could shortcut that route.
Right. I agree. Sometimes it's easier just to take somebody who's been in the game for a little while, seen some things at least, you know. But I'm curious, what are you guys doing in your practice? Like, could you describe to us what are the top 3 things that you guys are focused on to helping people stay healthy?
Sure. Well, first is making sure that the spine is overall in good alignment when it comes to curves. We practice something called chiropractic biophysics. It's one of the most researched techniques out there. So we apply to what the standards are for that to make sure that when we talk about structure, it's really about taking tension off the spinal cord, which we could get in detail a little bit more, but that's why we care about that. So making sure that people understand that, as well as that's what we're going to apply in the office right away if you need it, as well as making sure that people can understand that that being healthy isn't just like a quick fix. It's going to take time. You got to change your lifestyle. You got to be able to change your attitude on it, or else you're not going to get to health lifestyle. You're going to be doing symptom care.
Right.
And then the third thing is everyone has responsibility. Like patients are coming in for themselves, not us.
Right, right,
And
right.
that's what we also teach as well, right? Like, yes, this is a committed relationship, we're going to be your leader, but you're ultimately coming in for yourself to stay healthy. So that puts some responsibility on them when it comes to what do they need to do on their own to also get healthier as well.
Yep. Well, there you go. And you're seeing generations.
Yes, which is the funnest part is the funnest part of my day is when I have a family of three generations, grandma, or we use like abuela, then we also got the mom, and then we
Yeah.
also got the granddaughter as well. So it's so fun, and that's like one of the highlights of my day. Then the other fun part is, hey, is we got the mom doing her exercises, the mom and dad's doing their exercises, they're doing their corrective exercises, and the kids are just running onto the table to get adjusted, and I'm doing their pattern, as I call it, and they're just all having fun. They're all excited, everyone's getting healthier, and that's a really fun part to be able to do that all day, which is why being in a family practice and making that how I want to spend my days is ultimately what I ended up choosing.
Yeah, that's pretty cool. That's very
Mm-hmm.
cool. Yeah, yeah, yeah.
Very purpose driven and very rewarding as well to get to spend my days doing that for other people and families, be a
Yeah.
positive impact and add to their life.
What would you say is like the most rewarding part of watching a family heal together? Like what do you when you're seeing them heal, you know, maybe outside of measuring them on an x-ray, but like what how do you witness a family heal?
The the funnest part is changing their whole is having someone come in chiropractic and not really understanding and not because of any fault of their own, but they just have no clue. And let's just say they end up in our office because of an injury or something happened. I can think of a family in particular. Unfortunately, they were in a really bad car accident. Someone hit them. It was a family of five. It was mother, father, three kids. So they were all injured. Couple had like the parents were really injured. The kid had like nausea, headaches, had like all these little ailments that all of a sudden they couldn't figure out why. They went to the hospital, no one could understand why. And through our care in the office of actually fixing their spines, you get to see them get healthier. And then we also teach them of what it means and what's going on and why they're actually healing, and you get to see them get excited. And then their whole family every day is excited to come in. Then they're getting healthier. Then all these ailments aren't a problem anymore. Their nervous system's getting re-regulating. Then they're also seeing added value of what they had no clue that they even thought was a problem or that they thought when it couldn't get better. And all of a sudden, like their sleeping's getting better. They would have headaches all day or once a month, and all of a sudden they got no more headaches, like or a couple times a week. Like, oh, I'm not getting headaches. They got more energy, more focus. Like they have more motivation to get things done. They're not as lethargic. They had IBS or stomach problems or constipations for long times that they had no clue, and all of a sudden that they're also getting better. So one of my favorite things is seeing the people go through the evolution of actually getting healthier and then being excited and now understanding the way I was raised
Mhm.
of how chiropractic is so positive to stay healthy.
Right. So then, you know, you must have a lot of people referring their family members in like that. I mean,
Absolutely.
yeah, I mean, just to create a culture like that in a practice is so cool, you know.
Well, especially now that is I got some experience and a little wisdom. I still got the baby face, but now that
Yeah.
is I've been doing it for 5 years is yeah, now is awesome because is we have families who started injured but got healthier now are being preventative or doing maintenance care, staying healthy. We call it wellness care, right? So now after 5 years, you got the families who have been doing it for a while, have been now understanding being preventative. You got the families who are just starting. So like going into it and being on the like first half of my career or in the beginning of my career is it's really exciting to see how that time just makes that big vision that I ultimately had with my father of how it's starting to come to fruition, which is really cool.
That is really cool.
Hmm. It's
Yeah,
really
yeah,
fun.
yeah. You know, I think it would be cool to talk about what it's like being a young doctor, because I mean, you may have a significant amount of your patients who are older than you. So for the other young doctors or students who are coming into practice, coming out of school, like, could you share with us your experience on what it's like to be a young doctor and talk to people who are older? Maybe did you have some hesitation at first, or did people not take you seriously, or was it easy for you? Like, what was that like?
Sure. Well, that was definitely we're in the position of where having a little gray hair is actually better for the position sometimes.
Yeah,
But
yeah,
having a little bit of gray hair, they see that, especially when you first start, right? As you also got to think, as I was 23, as I barely got facial hair now, never mind 6 years ago.
yeah. True,
I had a
true.
real
And
baby
you had
face, right?
you just a clean shaven, man.
Right. And this is, for me, this is a lot. I'm ready to shave right now.
Yeah, yeah.
Well, not like you, man. Look at you. You got that whole thick
I
beard
know,
and
man.
everything.
I got that war beard. I got a couple of gray hairs in there.
There
It
you
wasn't
go.
this
So,
thick when I was in 20 to 21 or 22. It's with time, with time.
so that helps, right? And the key with that is, say you're starting off with making large health lifestyle recommendations where they got to change their lives. The biggest thing is projecting a lot of certainty and confidence,
Yeah,
because I know what I know as I started 23, but also as I've been doing this since in my life, my entire life since being 10 years old, right?
right, right.
So is being that strong minded and being that convicted and understanding the philosophy and purpose that helps, and being able to speak with a lot of confidence and the right training. Like you
Yeah,
mentioned earlier, Dr. Fred, having the right training, communication, learning how to talk to people, all as important as
yeah,
being able to help people.
right, right.
So when it comes to older people, is when I first started, is it's much harder to have people take that a lot more serious.
What do you think is going through their mind? Like, it doesn't mean that this is for all of them, but hey, maybe it comes up.
Sure, is what does this kid know, right? Or is at least what's the thoughts in my head? What does this kid know? Or how is this kid going to make me change my whole life when he's not even 25
Yeah,
and they're in their 40s or sixth decade? And they
yeah,
look
yeah.
at me like one of their grandkids, telling
Right,
them to
right,
change their life.
right, right.
A lot harder.
Yeah, yeah,
It just is, yeah. And so I could there's people open minded for sure, because I still have patients from when I first started that are still with me today. So
yeah.
it's not everyone, but let's just say, what are some of the challenges of starting so young? A lot more people don't take you as serious when you're on the younger side, which is a challenge to begin with.
Right. Not
So some
nobody's
oh, go ahead.
thinking. Nobody's thinking about. Well, this kid just went through an entire doctorate program before he's 25 years old, and he has his own business. No, nobody's considering that.
Those
You
people
know
who
what I
considered
mean?
are the people who are probably still with me. So, as you know,
Yeah,
is
yeah, yeah,
pro-
yeah.
probably being a little self-conscious is, oh, no way people are thinking that. But, as I
Yeah,
thought the other way was, okay, it's the other problem. That's another problem, right?
yeah, yeah,
Is
yeah,
also something that I noticed was communication. So, I do a new patient system in our office that I follow, where I do a new patient consultant exam on the first visit, then do a review on the second visit. But what I've learned over time, this is a very common theme that I started to recognize as a pattern. Those people who don't take me as serious, but like you said, may trust that coming out of school, I know the latest research and kind of understand that. They start hearing my story a little bit. They're at least willing to take that step. Because here's the thing: is I'm very confident with what we do and always have been. People just
yeah.
got to take that step. So like that's the thing. They take the step, and I know we can help them.
Yeah.
Once I have all the data, right? So now I have all the data, I do everything. But what I've learned was that first visit is not always as serious. They may be, well, I'm very comfortable in the office. They may call me AJ or Bud or Pal. And then all of a sudden then I go over their x-rays. I can communicate with them to make sure they understand how it's affecting their health and life. Then we start doing their treatments. Then they start seeing how they're actually responding and healing. That AJ friend communication starts changing into a patient doctor communication. Very simple is, instead of being AJ buddy or pal, is they just start saying doc, Dr. AJ, Dr. Goldberg, right?
Mhm.
All of a sudden there's that respect title that they start adding a lot more. Their communication, and now when they start listening to these little details I start saying, I can see that they're actually hearing what I'm saying now and taking it in.
Yeah. Yeah.
Mm-hmm.
And that's probably, I mean, would you say that's coming from so many different angles? Because, I mean, you're just like a lifelong learner. I mean, you're always craving the best knowledge for yourself, and you're always growing. So I'm sure that, in combination with like confidence in yourself, that you're able to heal people whether they want to believe it or not. Like you're getting results, and you don't question the principle of chiropractic. That's going to heal people. And so you're like, yo, here's the deal, guys. You come here, you're going to be better, and there's nobody better in this area than me. So it's your choice.
Right. And this is what we're going to do to begin with. And if you don't want to do it, hey, that's okay. Maybe this isn't the right office for you.
Right.
So is also getting more. So there's another thing is, we don't accept all patients in our office, right? Is if you're going to actually be a patient in our office, one, I got to make sure I can help you, make sure that we know what's going on, do a proper exam as well as make sure that you're ready to change your life, because we're going to be expecting to change your life with what we do. So we're going to make sure you're ready for that, as well as that you actually want to do that.
Right.
Because some people may just want a quick fix, may just want to get a quick crack or a quick adjustment. And then all of a sudden is we have two different goals, and just isn't going to be a good fit. So being very clear in communication of what everyone's goals are very important as well.
That's cool. And how do you take somebody who, like, let's say that they, their idea of chiropractic is something completely different from what you're providing. Maybe somebody walks in with the idea that they just go to the chiropractor like once every, couple of years because they hurt their back or something like that. Like, what are you doing to help teach that person what chiropractic is in the way that you're practicing?
Sure. Well, when it comes to our system, and what we do is unique and different most chiropractors, where we're actually changing the full spine. So we want to make sure people know what we mean by that, why we're doing what we're doing, and as well as how. So like we said, clear communication is very important. This is what's going to go on in the office. This is why. Here's the latest research to show why we're doing what we're doing. So we do a health talk in our office where it's open to the public. We do a community service for free, but it is a requirement for our patients to go just one time once they start care.
Right.
So they actually can learn how did they get there, what's causing their conditions, how is it affecting their overall health. Then, as well as we actually go over all the details of what people need to do to fix their spine based on the latest research, and as well as how long is it going to take as well. So I just pretty much lay it all out there before they even really start, and we're starting their actual corrective care or health recovery care. It's actually now is like, hey, this is just what it's going to take. This is how people fix it. This is what you got to do. And this is what we do in our office.
And is backed up by this research. So, you're having a component of like how the public understands health. The public understands health through research, and it's palatable for them because, we live in a medically based thought process like the population does. So it's cool that you're going, hey, look, guys, we can objectively measure the state of your health right now, and we can predict how long it's going to take for you to get to, we say 90% of your health, and and I use this analogy all the time. It's like once you get there, then you continue to work towards keeping it. It's like if Arnold Schwarzenegger was Mr. Olympia, but however many times, but he doesn't look like that anymore. I mean, he's still a big dude, but like, you got to keep going to the gym in order to maintain physiques like that, or, braces. Like I got crooked bottom teeth. Now I had really beautiful teeth, and then I didn't wear my retainer, and now they're crooked, And I had that, you got a really wide palate. Like it's good. My palate is starting to narrow. I gotta get new retainers and maybe chew some of that, that gum, that tree sap gum, or whatever.
I gotta strengthen it.
Yeah, I gotta strengthen it back. You know what I'm saying? So this is the whole thing with chiropractic too, right? I mean, hey, the times that I've not done like my home care as much, or I don't think in the past 7 years I've ever really had bouts of not going to the chiropractor. It's always been at least once a week, maybe even more. But my spine's in pretty good condition.
Absolutely. I've been adjusted once a week almost my entire life. After my father passed, one of my first jobs was like, oh no, who's going to adjust me?
Mm-hmm.
So that was one of my first jobs is after taking care of what I had to take care of, was like, all right, who and how am I going to be getting adjusted? Because that was always who adjusted me. So that was a new thing, as well as I had to figure out, as well as like, all right, well now who am I going to trust and now start adjusting me, right?
Right.
That's the new thing. Yeah.
For
sure.
Did you find I mean, obviously you found somebody.
Right. Well, it helps to have a resource under CBP under their website, doctor directory, idealspine.com. They have a doctor directory where you can search chiropractors who practice similar techniques as what I was implementing in the office of chiropractors in your area.
Yeah.
So when I put my zip code in there, I found a couple, and it actually happens to be one of the chiropractors who helped start with CVP as well. He just happened to be in the town I was in. So his name's Dr. Anthony Gambali. I've been getting treated by him for a very long time now. So we have a great relationship.
That's cool. And one thing that I want to point out is that you are getting adjusted still. This is something that is not as common as you would think in our profession. I mean, there are chiropractors and like, when's the last time you adjusted? I don't know, 8 months ago. But like, what? I don't know. It even makes sense. How could you? It's like being a dentist and not brushing your teeth. Like,
right.
Like, what do you do?
Sure.
Yeah.
Right. Doesn't even make sense to me. So that's what I'm saying, is like, I'm getting adjusted for myself. I got adjusted yesterday. Mm-hmm. So I get adjusted, and when I've heard that's a similar statement, like you said, that doesn't even make sense to me. That doesn't even resonate with me, and it actually bothers me, because when I was younger, I was a larger kid. Mm-hmm. And I went under a medical exam, and they were like, hey, he's on the larger side, he needs to lose weight. But the medical doctor was obese himself. So it was almost like, when I was younger, me knowing I want to be a chiropractor so early, I never forgot. I still think about it, and it makes me upset, where I'm like, I needed to lose weight. What about you, man? Like, how are you telling me to lose weight when you need to lose weight?
You're like, this kid's going to end up like me, so you better treat him better.
I guess so. So
that's what he was saying.
Right, I guess so. So, but to me, when it came to me knowing how I practice and me wanting people to make it a lifestyle, like, I practice what I preach. Like, everything I do in the office, I tell people they should be getting adjusted, stay healthy. I get adjusted all the time. people should be taking certain vitamins. I take my vitamins, right, as I do all the extra stuff, exercise, eat healthy, and eat the cleanest foods, right? So that is the lifestyle that I want people to live. So I practice what I preach.
Right. Well, dude, it's cool because, I was just on Instagram, and Paul Saladino, he's a medical
Yes.
doctor, he's like the carnivore diet guy.
Mhm.
He just came out with a video saying that he went to Spain to go get this blood. Oh man, hold on. I looked it up on my phone. Let me grab my phone really quick. It's cool. It's like they created this system where they essentially, it's like an outpatient procedure. You go for a couple hours. It's called Inusophoresis. Have you ever heard of this word? Inusophoresis. Oh, it's backwards.
Can't say I have.
Yeah, I can't tell.
I was reading it, but I can't say I have.
Essentially, what they do, they're filtering out heavy metals in plastic, microplastics, out of your blood. I mean, amongst other things, essentially, the Europeans created this procedure, and one of the bullet points is to help with post-COVID vaccination blood clotting in people. So they essentially take your blood and filter it, somehow, and they hold up these bags, and you can see like particles of little microplastics, like a lot. And they're filtering out, taking out the microplastics and the metals and all these kinds of things. They had a picture of a woman she had a silicone breast implant rupture, and they took like silicone out of her blood. Like there was a bag, and it was literally just like globs of silicone that were just cycling in her blood. Anyways, the reason I'm saying this, it ties back to chiropractic, because for me, like, I hear something awesome like that, and I'm like, I have to do that, because I've been exposed to so many things. They take out glyphosates or chemicals that we've been exposed to, and they're stored in our fat. So I'm like, man, I'm going to fly across the world to go do that. I have to try that. Apparently, it will come to America next year, is what they're saying. But I'm like, well, I want to kind of go right now. So, that sounds like an awesome thing. The reason I'm making that significant is because people like you and I, when we understand health, we understand what it means for our livelihood. We understand how our health correlates to our purpose. And like you said, when your father passed away, you're like, shit, I got to find a chiropractor who can take care of me at the level that I know is possible. You also not all chiropractors are getting the same results. So you wanted to pick a chiropractor who's going to give you the best results for the state of health that you want. And you're willing to go there. I'm sure that maybe you guys are probably just helping each other out. But, if you had to pay for it, then you probably would, because what are you going to sacrifice your health? I mean, it
wasn't a thought.
Huh?
It wasn't even a thought. I would have paid $3,000 ready to go. I didn't care.
Yeah, exactly, man. Like I've been sitting in school for too long because my spine was on the green line, and after being in school, my L5 and S1 have started to compress, and so I'm like, shit, I got to get a wobble chair, man, and rehydrate my discs. So the first thing I did was I went and bought a wobble chair. My neck curve, I still have lordosis, but there's like a pretty significant straightening of the upper cervicals and mid cervicals, and I'm like, that it's never been like that before. So then I bought myself a traction and a head weight. I'm like, immediately, like, no thought, like, I will not be unhealthy in this way. And even if it was thousands of dollars, I'm like, well, I got stuff I could sell. I mean, I would, You know what I mean? Like it's too important. And why I am bringing this up is such an important aspect of what you do for yourself is that this is something that your patients will model after, because you'll go to any length to take care of yourself, and it makes it easier when it comes time for talking to patients about an investment in their health. You're like, well, listen, I invest in my health all the time. Like I understand that maybe this seems expensive to them, or maybe it seems like a deal. It depends on their perspective on what they've been going through. But investing in our health is such an incredible mindset to be in, because for me, and being an entrepreneur, it drives me to do more. This gum, I was licking the gum up today, and it's not it's $7 a pack, $7 or $8 a pack of gum, and you're not getting that many pieces of it. But I'm like, but I'll have a healthier mouth. You know what I mean? Like I'm like, all right, well, I gotta make some more money so I can live at the state of health that I want to be at.
Sure.
I want to go fly. I gotta make money enough to fly to Spain and stay for a while and get some of the plasma.
Well, being able to, so I think is with his investment in time and resources and being rewarded for helping and adding value in your life that is a benefit of what we do, right? Is you bring a lot of value and people get a lifetime of value as well. So I think really the key is when it comes to why we do what we do, it also helps that we also have a certain standard of living that we want to apply for ourselves. So if we can help people achieve their goals, it also helps us to raise the standards for the whole office as well.
Right. That's true. Yeah, you're an incredible leader, bro. That's all I'm saying.
Oh, thanks. That's what you got.
Yeah.
Well, so through trials and tribulations, has got a little, like I said, wisdom starts to help to be able to do that now. But is having fun and being excited every day, is being in the spot where we're at, where we're really starting to make an impact in the community, and we're just getting started. It's fun to be where I'm at.
Yeah, it's true, man. I mean, it's cool that you got your workshop going on and you have that as a service for the people in the community. If anybody's watching and you're in the, what did you say, Saugus?
Saugus. Yeah.
Okay. At least I had the letters right, just the pronunciation.
It's all right. Us Bostonians have weird pronunciation. So it's in the North Shore of Boston. So if you're in the Boston area, in the North Shore, we do them on Thursdays usually. So, but all our information's on our website, gfcspine.com.
Nice. True, man. Well, what else would you like to cover? What's something that like you're working on? What's something you're working on yourself? Like how are you growing yourself right now?
Myself right now, so is learning is how to achieve new goals. So there's a couple different goals I have, as far as one to make sure clinically, always getting the best results, make sure I stay on top of that. So always challenging myself to stay up with what's going on and reading what I can or watching videos to be able to make sure I can stay up on the latest research as well. Then also is having healthy habits and activities that are also challenging to me, but also trying new things to make sure I don't get complacent or just do the same thing. So it's something I started taking up this summer is actually golf. So learning how to play golf has been something new. I've also been adding a lot of my time as well.
Oh, that's fun.
Yeah.
Well, it's probably time to do it, right? Because you're going to be snowing out. You're not going to be able to find your ball in the snow.
No, especially being in here, is you only got like 4 or 5 months of it. So
yeah.
So, but between that and then also being in practice, running a small business and being in the office, as well as trying to keep all my healthy activities. I also do sauna a lot. I do something active every day. I go to the gym a lot. I go to also just be some type of cardio a lot. So doing something to always maintaining it. I also like to cook as well. So I
Nice.
stay pretty busy.
Nice. You have like a go-to meal that you make?
I do. It's easily like a nice grass-fed steak on the cast iron skillet.
Nice, bro. Heck yeah.
Yeah, nice good old
Like,
steak, avocado.
yeah, yeah, yeah.
Yep, nothing wrong with that. I've been doing my new thing's pickled onions. So I've
Oh yeah.
been learning how to make pickling. I've been doing pickling. Apparently, I'm getting into vegetables and pickling. That's been my new thing.
Oh, okay. Yeah, well, you said you have a vegetable garden now.
Yeah, so I guess it makes sense. But those have been my new cooking hobbies that I've been into.
That's cool, man.
Kitchen, yeah.
Yeah, man. Nice, dude. Well, cool, man.
So, well, anyways, but that's the biggest thing of what's going on in mine, and when it comes to with what I'm doing for myself and for the office is just being able to be present with what I do all day in the
Mm,
moment to be able to actually serve people the best,
yep.
but also building something that goes on beyond just me, but also being able to focus on, if you want to call, being able to not just be in the practice, but also working on the practice as well. Something also is that's also something I'm working on as well to be able to do more for that for the community.
That's cool, man. Do you have like plans to, other than your workshop, do you have plans to get out in the community in some way?
We do a lot of events where, for example, we do a town fair. There's actually a couple town fairs that's coming up. We do
Mm,
some of those. We have a couple patients that put on events, so we do a few of those. There's also a couple of health fairs we do as well,
that's cool.
and then some networking, some meeting other providers or other business leaders as well.
Okay, that's cool. Do you, how, for newer doctors, like what would you recommend is a good way for people to network?
Keep talking to people. That's really the biggest thing. Networking is just a term to just talk to people, build relationships. That's all I kind of focus on, building relationships. It's not going to happen overnight, but all of a sudden you start doing it for a while, you start realizing you're building a community. You have a vast network of people that you know now.
Nice.
Yeah, and don't be shy. Go to the events you don't want to go to. The ones that in the middle of the week that you're like, ooh, I'll just go home. Go to those events.
Yeah.
Don't be afraid to go talk to new people.
Do you feel like there was a part of you that really had to overcome like like being shy, or like what was the thought that took you from, maybe not talking to people towards like, okay, making connections, booking people in to come see you? Like, was there something that you learned that really set that off for you?
Well, I've been an entrepreneur my whole life, so very comfortable with talking. And if you want to use the word selling myself or understanding or speaking with a lot of certainty, confidence, and passion about what I do all day, we can use that. People just feel that and get excited on that, and that's really what people want to know more about. So to me, it was very normal, and I was always able to, if you want to use the word talk or sell myself, be able to do that. That helps. I'm definitely what's funny is I'm more introverted. I'd be more comfortable just hanging out. Like I said, that's probably where that comes from. I'm more comfortable staying at home and not doing anything. But I know the type of personality to be successful also involves you having to talk to people.
Right.
Like you're not going to get, like, in other words, is what good is my skill if I don't have anyone to treat?
Sure.
So I also, and we're not, unless you have a big following or you do something to create an attraction, we're not in the field where you put a sign on the door and people just start walking in.
Right.
And then I had the benefit of having an office to step into. But then when it comes to how do I want to do, is all of a sudden that patient population dropped really quick. So now it's like I was kind of starting my own thing, even though I had the office to practice. Now it's like, all right, how do I get new people in the office? You
Mhm.
gotta go talk to people. People gotta know you exist.
Yeah. Yeah. So like give us an example of places that you would go. I know it may seem trivial, but for some of these students that watch this, um, they have no idea and they don't know where to look. They haven't been an entrepreneur their entire life. So, you know, even as an associate, they have opportunities to either make bonuses or commissions on people that they bring in. And it's a skill that some of these students want. They want to know how to talk to people, but like, you're not in the office, you're just out and about doing, whether you're at the gym or you're going to get the grocery store or you're out golfing. Like, give us an example of times that you've taken that step to talk to somebody and then it was successful, and maybe a time where you try to talk to somebody and it wasn't.
Well, it's usually having no expectations out of the conversations. And usually how it starts is just one, first of all, just be curious,
Mm-hmm.
right? Is usually it doesn't start off with chiropractic. Usually just starts off with me recognizing something in them. Like for example, like cool shoes. Like sometimes ready. Have you ever been in a situation where you received a compliment and you were upset?
Yeah. Well, I'm sure that it's probably happened.
That you were upset, you received a compliment?
Maybe if I misinterpreted it, if somebody was like that, I mean, probably, maybe not very often, but maybe somebody said something to me in a complimentary way, and I was just like, wait, I didn't understand it.
Were they being genuine?
Yeah, well, I'm sure that sometimes, it's funny because like I'm thinking of like an exception, but maybe somebody says something in a complimentary way, but maybe I have a different definition of the word that they use, and I'm like, wait, wait, what does that
So there's
word
a
mean to you? Because it means something crazy to me.
well, there may be a misunderstanding, right?
Yeah, totally,
Or
totally.
are you saying something, for example, um, are you saying something to get something out of it, right? For example, if I or someone was to go to a bar and all of a sudden you start hitting on someone, right? Are you giving them a compliment because you really want something out of it?
Right.
Or are you
That's
just
good.
being genuine?
Right, right, right.
Right. So when it comes to when it comes to just being curious, I also, when I see something I like, I just kind of compliment it with no
Yeah,
expectations. And sometimes that turns into a thanks and move on with the day. Sometimes that turns into conversation.
yeah,
And then those are the conversations where wherever I'm doing, I'm just always myself and it's never leaving me. So wherever I am, just be curious, talk to people. And then all of a sudden you may start talking to people. That's what do you do? Oh, I'm a chiropractor. As soon as they hear that, that kind of like opens the door. And then that you start talking about that as well.
right, right, right.
And
Yeah,
and then what helps too is when I start talking, when I have the opportunity to talk about what I do, a lot of passion comes from it. I get very excited. I can speak with a lot of energy and excitement when someone gives me the opportunity to. And sometimes they may not even understand me, but they go, all right, he's excited about what he does. I'm going to just see what he's all about. I have no clue what he said, but he's pretty fired up, so I'll try it out.
yeah, yeah. Nice. Well, there you go.
Yeah, so that
Yeah,
helps.
yeah. Totally, bro.
Hmm. Hmm. Yeah, so those are like when I go out and meet people, that helps a lot. I knew the internet would be also very helpful, so I spent a lot of time on Google and building the website to create a good funnel to be able to attract people and
Mm,
have a resource that people can see and be able to get in the office that way as well.
yeah,
So being out in the community, talk with people, using a good website, creating some traffic flow, doing some of the business stuff as well also helps. Got to work on social media more, but those things help.
yeah. For sure, bro.
Hmm.
Nice, man.
Yeah, that's what I do.
Yeah. Well, that's good, man. Hey, you're growing your business.
Well, now what's awesome is 5 years in is I do these events because I just feel like it's important to be in the community because there's usually, at least when I go, one family that didn't know I existed, but they needed they needed to hear our message. And usually it's at least just one family, if not usually more, but there's usually at least one family that it was really important for me to be there. So I always go there with a mindset with that. I don't need to go to these events anymore. We're a lot more referral based practice,
Yeah.
which helps a lot. And then we also have a lot of online referral based practice. We've been doing it for a while now, so it all that helps. And I don't need to be doing these events, but also it just gives me a lot of purpose to go to these events because never know where you're missing that one family that you could change their whole family for generations.
Well, dude, for sure. I mean, here's the deal, man. You go out to these events and you're teaching people about health, which is what the whole point of our podcast today is, right?
Mhm.
So, like, when you're going out to these events, what's like your number one bullet point that you want people to walk away with?
Teach people how the nervous system and your spine is about staying healthy. Like in other words, you're not taking care of it, you might not be at your best.
Right.
And
So
I
what does
just
that
bring
mean for their
I bring
life
awareness.
if they're not taking care of their spine? Like, how are you bridging that gap between like
Sure.
they know nothing about the spine versus like how are you communicating to them? Wow. All right. I know something that can give you the greatest life that you could imagine. Like, what is it that you guys are doing?
Sure. Well, we do usually what works best for me and allows me to be in my element that I
Mhm.
found best for me rather than just talking about it.
Yeah.
One of our exams in the office is something called a thermography scan,
Yeah.
which is a fancy medical term for measuring inflammation.
Right.
And we have a device that actually measures inflammation in the nervous system and in your spine.
So you're going
Because
up and down their spine and you're showing people, yo, dude, you got something going on in your spine.
right. Well, how do we attract awareness and why do people even care about that? Because
Yeah.
we also have these beautiful that I created these giant stands or I'm losing the word, but giant like poster
Uh-huh.
that shows a thermography scan with the autonomic nervous system chart that goes to all the different organs. And it
Okay.
says, we're measuring inflammation. And then, do you suffer with any of these health conditions? Because if there's inflammation in the spine, it affects the nervous system. It could affect the communication to the organ. The organ may not work as well. Now the organ starts producing symptoms.
Nice.
So we actually show the autonomic nervous system to all the different organs and say, uh, we're measuring inflammation. Do you suffer with any of these conditions?
Sure,
And
sure.
it has a list of very common conditions. So that usually attracts people. Then I make it very fun, where I have I bring a big monitor. I bring my TV. I hook up my laptop and device to the TV, so anyone walking by, you can see the inflammation. It's a very attractive booth. Usually, it's very popular when I go to these events.
That's
So
cool.
we
So
do
you
these
got
big,
like
yeah.
a bunch of people lining up around the booth.
Exactly. Yeah. So I
Yeah.
go to these events. I'm working the whole time. I usually bring someone to help me so that way they can be doing. We do these for free, but we do offer them an opportunity to come into the office to book an appointment for a full exam and X-rays because we are at an event, right? So it's just like one of the several things we do. So we show them what's going on. Hey, this may be a problem that's contributing to what you're dealing with.
Yeah,
Do you
totally,
want to
man.
come in the office and figure out if this is worth your time, or is this worth your time to figure out if our office can help you with this?
Dude, for sure,
And
man.
if they're into it, yeah, then hey, if they're into it, great, we'll get you signed up. If not, they at least learned that if they're dealing with something that they didn't know maybe come from their spine, they're at least going to walk away with that and not forget it.
Totally, dude. Well,
It's
that's
going to
cool,
be
man.
something.
Hey, look, we got 7 people who are joining in right now. So we got people learning from you right now. So what I want to do is, if you're open to it, like, what does it mean for somebody to have, you're taking these thermography tests, right? And the average person is walking by. You're at a fair or a health conference, so there's 8 million booths, and there you're using the TV to go, hey, look, I can show you what's happening in your spine right now. I could tell you that there's something's wrong. And depending on where this scope is touching you on your spine, it could mean that you have organ problems and you may not be even feeling anything. So aren't you curious about understanding what might be happening, or like what level of health are you at? Look at that. We got 11. We are growing. How about this? Let's pick up the energy, AJ.
Look at us.
We're picking up
The
the energy.
excitement.
Yeah,
It's the
exactly.
excitement. The well, that's the thing is that's why is you don't go to these events trying to get patients. Like I never go to these events trying to get a patient.
Yeah.
I'm just going to spread awareness. And I'm going to spread awareness about how chiropractic's about keeping the nervous system healthy. We're going to have fun. I'm going to try and teach them really quick. And if they're not into it, hey, that's their life. That's their choice. All good. No problem. But I'm not trying to get them as a patient. If they see value and they want to if they want to look into it, I'm happy to look into it with them, but only if they really want to. And then that's the thing is just teach them about chiropractic, teach them about the nervous system, move on.
Yeah, man. I mean, here's the deal. You get a family that walks by, they got kids. You're like, hey, you know what? Little Johnny's got asthma. Well, like, well, did you know? Let's scan his back. You scan his back and you see that he's got some inflammation in his neck, in his mid-thoracics. You go, well, that makes sense. Got asthma. So, you know, it's an incredible opportunity to go to these health fairs and talk to the public because they think chiropractic's for pain. They think chiropractic's for accidents or injuries. They don't know that chiropractic is, you can help people who have Parkinson's. You can help babies that have epilepsy. You can help people that have allergies. You can help people that have migraines, who can't see or can't hear well. Maybe they got heart issues. I mean, this is the whole thing. I mean, you could look at somebody's posture walking by because you've been trained with CBP and go, wow, man, that guy's got heart issues. Whether he knows it or not, that dude is suffering from heart conditions, or he can't breathe, or that person's definitely got stomach issues. You know what I mean? So it's a pretty cool thing that you're doing to go out to the community and tell people all this stuff, you know? And, it would be crazy for them not to come just right back down the street to your office because you got an entire family practice.
It doesn't even make sense to me. It's just like the chiropractic not getting adjusted, not knowing about it. You don't know, but it doesn't even make sense to me once you know.
Right.
Yeah. So practicing what we preach, right? Like that is the lifestyle. That is just what to me is going to come out and be projected. That what do you mean that you don't want to even take the step to figure this out? It doesn't even make sense to me.
Yeah. So then, the next thing is like, all right, guys, how do you take a person who is not, who may not be seeing it, and not everybody, maybe it's not the time or the place, or maybe they're just walking by, they have no clue, but it would behoove us to figure out how can we stop a stranger. And, we've been on this podcast for an hour and 15 minutes talking about health. But how can we stop a stranger and in like a minute or less, get them in the first 10 seconds, 5 seconds, how can you get them to stop? Well, one thing is to do what AJ's doing and have something physical that people are curious to find out about themselves. Like, hey, do you want to know X, Y, and Z? Here, you want to take this simple test? We could figure out if X, Y, and Z is happening. You just got to hook them in. And then when they're there, if you're trying to talk to 100 people in an hour, then you're probably not going to be able to have 10-minute conversations unless you're talking to a group. But really what would be great is to have something that we can all go out in the public and have a little bit of juice to just have a something strong, like an elevator pitch about, yo, this is chiropractic and it changes your life. The thing that I'm hearing you say that works really well for you is just being excited and having a lot of energy. I mean, most people are consuming information based off of what they're seeing in our body language. They're not remembering all these big words. They're not remembering. They can barely remember what they just listened to at the last booth. They're already on to the next thing. So
they're thinking about all the stuff they got to do after the event with the kids.
Totally. Their mind's in 18 different places, and yet they're sleeping on the fact that if they chose chiropractic as a lifestyle, and if they chose to come to a practice like yours, they actually would create more time for themselves and their family. If you're able to give people energy, that is something that anybody at the highest level or the lowest levels of life would benefit from. When you have more energy, you can create more time for the things that are important to us. If you have more energy, maybe you can play with your kids after a long day of work. Maybe if you had more energy, you could get a job that pays you more money. Like maybe you'd have time to spend time with your wife or go on a date because, and whatever. I mean, like chiropractic, we talk so much about the organs and the functions of the organs and the nervous system, and it means energy. You'll have more of this, but like what I think would be beneficial as an industry and is to talk about the story. Like what does more energy mean for all these people? What does more energy mean for a child? You said this at the beginning of the podcast, where more energy for you were sick for less than a day. Got adjusted and then you were fine. But your friends are sitting at home and they're sick for a couple of weeks because they don't have enough energy to heal. So what does that mean? For kids, sick for 2 weeks. Maybe kids just want to go have fun. What does it mean for an adult to have more energy? I mean, like, depending on where they're at in their life, it could mean an incredible amount, I mean, obviously you have this workshop and you're talking about this kinds of things to your patients, which is what separates you from everybody else. You're taking these steps to be able to teach people, look, what I do is here to create an impact for not only yourself, but your whole family. And this is why you also saying you see grandma, you see mom, you see the kids, you see grandpa and dad and the other little kid, they're bringing them in. And then people are calling saying, hey, you got to come to this guy because, he gave me my life back. Maybe these people are not able to walk. Maybe these people aren't able to go travel. They can't go on an airplane because they can't sit for that long. Like chiropractic opens up the world for people to live an extraordinary life. And so somebody like you is going out into the public and sharing all of this and teaching people, hey, look, I have this instrument. It can show me that you're not living the best possible life that you could. So I'm just curious, do you want that life? Because if you do, show up to this office on Tuesday.
Absolutely. Yeah, you're fired up just talking about it. I know.
Yeah.
I'm in. Whatever you want, I'm in.
Yeah, exactly. That's why when they were talking about the blood, they're like, bro, you can take the plastics, the metals. I'm like, no, I got so many tattoos. I probably got all kinds of metal toxicity and plastics and chemicals from the military and drugs and all kinds of stuff floating around in my blood. I'm like, dude, I got to get a first class ticket to Spain. I want to go for Christmas, dude. Screw America. Like, I'm going to go hang out in Spain for Christmas,
Yeah.
Clean my
worst
blood.
Way to spend Christmas. Yeah, there's worst way to spend Christmas.
Yeah, totally. The reality is that I'll fly to Spain, get the blood, and then I'm going to hightail it back to Italy because I'm just saying that it's pretty nice over there.
Okay.
Yeah.
I wouldn't know.
Gotta go to Italy, man. It's good.
Okay. Yeah. So if we were to go back to the events, it's really about just communicating spinal cord and tension. Everyone understands. It really helps to use analogies, and quick one-liners usually help to speed the gap, close the gap, make it quick.
Yeah.
Which is also an art as well.
Yeah. What are some of the analogies? What are your go-to analogies?
Well, I throw people off for a loop and I get them curious first. And I say, health is energy. And I make them repeat it after me. And then I say, energy is health.
Yeah.
And then they're curious. And they're like, what do you mean by that?
Yeah.
Well, then I usually bring them through a thought process of how their body works. So I usually break that down into 3 or 4 questions and a methodical way for them to get to think about it. And this is just if you're in the general public. First is what controls everything in the body. And if we were to do some role playing, if you wanted to play along, I would ask you these questions.
Yeah. All right, do it.
Hey Dalton.
Hey,
Hey
what's up, bro?
Dalton is we were just talking about chiropractic and I was just saying health is energy. Energy is health.
Health is energy. Energy is health.
Yeah. So
But
do
what
you
does
want to
that
know
mean,
that?
though? What does that mean, dude?
Exactly.
I
Good
don't even
question.
get
Good
that.
question.
Yeah, yeah.
So let's talk about it. Let's break it down, right? So let's
Uh,
start with what controls everything in the body and the brain, or what controls everything in the body. I just told you the answer.
yeah, brain.
Brain. Yeah, you got me. So the
Brain. Yeah,
brain communicates to the body through the nervous system. Would you agree?
yeah, I guess so.
Yeah, so like is the brain communicates down to the spinal cord through all the electrical wires to go to the entire body. Does that make sense? Have you ever heard that before?
Yeah, yeah, yeah.
Like, and then as also what also helps is when it comes to showing people is right, like being able to show them so they can feel it, like running their hands down their spine, and then they understand spinal cord as well and energy.
Uh-huh.
So the brain communicates through the spinal cord through the wires, and when everything's strong the energy is really fast and flowing through. So that's health is energy.
Yeah.
Does that make sense so far? So
Yeah.
let's talk. Okay, good. So let's talk about now your posture and overall nerve strength. If think about an electrical wire, if we were to add resistance to an electrical wire, does it work at its best?
I guess not.
No, it would add some resistance. Wires don't like resistance. So let's talk about your posture. When we go from a good posture to a posture like this, your spinal cord's like a wire. Now you're adding tension to the wire. Think about your phone charger, right? Is if you ever plugged in your phone and you ever bend that wire right by the phone port? Have you ever done
Yeah.
that before?
Mhm.
Yeah, it bends, and then what happens to the wire? What happens to the wire?
It wears out.
It wears out, and then the messages or electricity doesn't go through, and all of a sudden you wake up with a dead phone.
Right.
So, long story short, your posture is the same way. Is when we have a good posture, that affects your spinal cord, and that's that health energy. Good posture, strong spine, energy's flowing through. Now let's say something happens, your posture gets affected, it adds resistance. Does your body work at its best if the energy is not going through your spinal cord?
No.
Yeah, what do you think? Based on what I'm telling you, what do you think? Like, what's your guess?
Well, yeah, I mean, hey, if there's resistance, then it's not going to be good. And so I guess you'd want the opposite.
And then when that gets affected, when there's resistance, that now affects the brain's body to work with the body. Now your body doesn't work at its best.
Yeah.
You're not as healthy. Health is energy. So if you don't have energy running through your nervous system and spinal cord, and you have a forward head posture, you're not as healthy as you can be. And the research shows that.
Yeah. Well, there you go. Simple as
Yeah,
that.
that's my not a very simple elevator pitch, but that's usually like what I gotta do, and that's why I need all these. That's why I usually have a thermography scan or something to help me with that as well,
Yeah,
or I
yeah.
have charts or something because people. What I've also learned is people can't always uh, picture it, so having a picture helps to explain it.
Totally. Well, hey, man. I mean, this is the whole thing where people learn simply. Here, let me grab this poster real quick. We all know this one. I mean, do you bring this thing
Well,
out?
that's something that's on my like that little champ that that's something that I have like on that poster board when I go to the
Right,
event.
right,
So
right, right.
usually when I'm explaining it, I have that. If you show that, people can see the wires. So
Oh, yeah,
now
I
you
know.
see it's all connected.
Well, right. I mean, you're like, hey, man. I mean, if somebody comes over walking like this and they're all hunched over, you're like, bro, I don't know if you know it, but I probably guess like, do you have heart issues? Do you ever have trouble breathing? You know, do you have trouble digesting anything? I mean, you could look at somebody and be like, bro, and they'll be like, how do you know that? And you're like, well, I'm looking right at you. You want to see? Look, watch this thing. Obviously, it doesn't make
Right.
sounds, but whatever. Like,
But,
you see somebody
but the
with their
point
head
being
forward,
is,
like, bro, do you get headaches, bro? Because hurts my head just to see you like that.
well, picture's worth 1,000 words, right?
Totally. bro. And this is
So
what's
they
so
look at a
cool.
picture, they get it quick too. So is if you want to talk about communicating fast, how do you get the point across about staying healthy? You show them a picture. You adapt your communication skill to how do they learn quicker.
Yeah, man. And I think it's easy too. Like, people really respond well when you make it personal to them. When I'm having conversations with people at school, just my friends, like every time somebody drops something and catches it fast, I'm like, man, you got a good nervous system. It's like a compliment. And if they miss it, I'm like, bro, you better get adjusted because you should have caught that. Your nervous system's not working great. You know? Why wouldn't you be like, Spider-Man, bro? You should have caught that. It was right there. Not paying attention. Your nervous system can't figure it out. I mean, this is the truth, right? I mean, when something falls, our body starts reacting before our consciousness even conceives that we're reaching for it. I was just at a seminar this weekend and learning about our nervous system, and it was so fascinating because we have an aspect of our brain, and it interprets information faster than we can conceive. So there's like, our eyes are taking in light, and all it is sending a message from the retina to the brain, and the through the optic chasm. And there's another part, there's two parts where the visual signals go. And then once the brain interprets what those are, it sends other signals to our body, right? So the reason I'm saying that is a reference point where there are aspects of those signals where these processes start happening before our mind conceives that it's processing everything. Like, our brains process way more than we're aware of all the time. We're not consciously thinking about our heartbeat. We're not consciously thinking about our breath rate. We don't have to think to regulate our body temperature. Now, there are people on this planet who can consciously change their heart rate, or we can choose to breathe in a certain way, or we can, through breathing, you could change the temperature of your body. But the reality, and what's so fascinating to me, is that our brain is receiving signals from all the nerves in our body, all the skin cells, all our muscle fibers. Like, every time I move my head like this, there's information going to my brain. And the fact that I think of like basically none of it, is incredible. And so it's just cool to go, well, whether you're aware or not, your state of health continues to perpetuate. And our body, like you're saying, health is energy. If we have more energy, then our body replicates itself stronger. And if it has less energy, this is where we see sickness and disease. So, like you said earlier, if there's resistance in a wire, there's less energy that gets to our organs, no matter where it is. If you're watching this and you're not a chiropractic student or a doctor, then, it doesn't matter where in your spine. This is a whole electrical system. If you got something that's creating a block of energy here, it's affecting everything below it. So, if you see somebody or you know somebody and they're on a computer all the time and their head's like this, then they're cutting off all the energy to their organs. And when they're standing up, if their ear is past their shoulder, then they have serious health issues, and they may not have symptoms. This is also the whole incredible part about our body, is that we're so resilient. Like, our body could be actively deteriorating, and our brain is shutting off the red flags and the sirens, going, oh shit, there's something wrong here. Our brain's shutting that off so we can continue to live and to go to work and make money. Like, hey, if you need money this month, you had stress. Like, people have stress in their life, so as you go out to all these fairs and stuff, it could be easy too. I'm now realizing why I'm saying all this, because an elevator pitch, right? You look at somebody and you can look at their posture. If their head's over to the side, they got stress in their neck, and it's affecting all their organs. There's no way that person isn't having, like, they can't think clearly. They probably have headaches. They may have some allergies. They may have some sensitivities to food. They may have sensitivity to light. Their adrenal glands are probably all messed up. And you could just assume that based off of how they look. And it would be an easy hook to just be like, you know what? I can see you. Like, do you ever experience these things? And the probability that they're going to say yes, if you just say, hey, do you feel like you have way less energy than you should at your age? They're all probably going to say yes. Like, that's an easy question. They're going to be like, yeah, I could tell. I could tell by your posture. And then you go, look at this thermography. You want to double check, but it seems to me like you could have this and this out just by looking at you. And then they're going to wonder, how does this guy know that? They're going to show up, you know what I mean? Like, if you're telling them these things, you could just assume that they're happening, and the probability that they are is nearly, I'm saying 100%. Statistically, people who have fatigue, it's probably in the 90s, 80 at least. People, I feel like I don't have as much energy as I want, and I think about my health every day.
There you go. Yeah. Well, think about the people who are the ones who are doing best at the end of life. Let's talk about quality of life, and why do we even care about this? Well, it's quality of life, right?
Yeah.
Hey, we're all going to die one day. That's the one thing none of us can avoid. So what type of life do you want to live? And then when it comes to the end of life, what are you doing now to make sure you have the best full life? Because the ones who, I also point this out in the office, and you can probably think about someone, and even if you are listening, is think about someone in your personal life. Think about the one who are in their latter end of life, who are in their 8th, 9th, or even possibly 100th decade or 10th decade. Yeah. And think about the ones who are doing well. And what's their posture? Pretty upright.
Yeah.
But then think about the people who are at the latter end of life in the same position and are not leaving the house, have no energy, can't walk, dealing with diseases, right? Like major diseases, like a lot of chronic heart issues. What position are they all in, right? Like the role models that you want to be like at the end of life, most of them are like this. The ones you want to avoid, most of them are like that. Yeah. And most people don't know that or notice it because no one's ever pointed it out. But I bet if you're thinking about that person right now, I bet I'm pretty close to that being pretty accurate, where the more upright they are, the healthier they are. And they're getting older, but maybe they're moving slower, but they're still living life. And they're still pretty active. They got a good quality life. And the ones who aren't doing well, going forward, we call that aging. And there's a difference between getting older and aging. No one wants to age, but everyone has to get older.
Well, here you probably see this too, that children, when we're x-raying their spines, are having similar spines to 70 and 80-year-old people because of technology. You know what I mean? Right. It's crazy to see a child, and this is just because, parents don't know. It's not because you guys want your kids to be like this, but you can change it. You just have to create an environment where they don't want to be on their phone all the time. And that may be easier said than done at first, but it absolutely is possible. And to be honest, kids don't want to be on technology, even if they're screaming for it. They want to have connection with each other, and they don't know how to do that. So if you're a parent and you're watching this and you have children who are on the computer all the time or on their phone, you're creating health problems for your child. It's not because you want it that way. It's not because that's your intention. But I'm telling you right now that you're creating a problem for your child's health if you let them be on their phone and they're looking down all the time. I have a whole stand. This is the stand my laptop goes on. So if you imagine that, it's on a desk, and it raises up the screen to my eye level. And I use this every day. I'm in school for 8 hours. I'm professionally on my friggin' computer all the time. And what has happened, even to me, my neck has started to go forward, so I have to undo it. I mean, here's the thing.
Right. Well, sometimes is they also don't know either, right? Like the parents don't know either. So that's why you got to be out in the community to teach them. Sometimes you just don't know. They don't know they're creating a problem.
Absolutely. And yeah, that's exactly the point. And the reality is, if their children are doing it, they're learning it from their parents, whether you think that you are contributing to that or not. That it's part of the culture of where we are, and things are done so much on the computer. It's easy to give our children electronics because it grabs their attention. You can essentially like tame a reckless child by handing them a device and letting them play a game that's super highly addictive, and it helps you just get through the day, which everybody, I'm not here to tell you how to be a parent. I'm just saying that this is very common. And I'm not saying, all I'm saying is, because of that, children are less healthy and parents are less healthy. It's not just about children. It's not about parents versus children, but children's spines are way more susceptible to growing in a way that may not be undone in their adulthood. But children also are able to heal the fastest. So they have way more flexibility in their spine, and so does women. But it's important for you to seek out chiropractors like Dr. AJ, because he's going around telling you this. He's going around telling you what is creating problems, and could create lifelong problems for your family if you don't look.
Well, let's talk about them not knowing and then understand why chiropractic's even a more important lifestyle. Because now is we all live in a technology world. We're all forced to look down. So even like you said, even we know what we know, and it's hard for us to avoid it all the time. So teaching them a new lifestyle, right? Making sure they understand how chiropractic is now is necessary, because they're all day long affecting the nervous system, looking down. That's why is getting out there, teaching the community, of giving them and empowering them to take control of their health is the biggest thing. And that's how, like we said, right? And teaching them and empowering them to take control of their own health, and it's their responsibility for them and their family now.
Absolutely. I mean, this is the whole thing. I mean, people don't know. Chiropractors don't know. There are chiropractors who don't know this. And there are chiropractors who do know this, and they don't talk about it. Also, equally, I think that that's more of a, if I had to say, if I had to get rid of one, it would be, if I could help the chiropractors just learn how to say it, because even though they know it, then that would be incredible. That would be my contribution to our profession, is to teach chiropractors who do know what is happening but don't know how to say it. Like, it's as simple as what we're saying on this podcast right now. Hey, Mrs. Jones, your child, you came in telling me that your child can't pay attention in school. They're crazy around the house. They've been labeled with all these disorders of learning. Your kid's head is jammed to his chin. So if you'd like to have more peace in your home, and this is going to turn into other things. It's not going to get easier. So it's up to you. If you'd like to have peace in your home, and you'd like to give your child like the greatest opportunity to eliminate health problems as an adult, and then for you just to like have a chill moment with your child, like, this is just come in here and we're going to help. I'll teach you how to talk to him. But the reason that he can't pay attention is because he's literally stretching his brain. You know what I mean? Like if I went into your brain and started going like this, your brain wouldn't like it, but that's what's happening.
Same thing in the neck too, right? As you're looking down, you're adding tension like a rubber band. You're
Yeah,
stretching the rubber band all day long.
I know. It's not good. It's like somebody jerking your arm all day. You know,
Yeah.
that's the response that your brain is receiving. Your brain is screaming, and it's just normal. It's not normal. It's very common for people to be this way. People think that these psychological diseases are normal now. Why is that? Why is there an uprise in psychological discrepancies for children and adults? They're depressed, they want to kill themselves, they can't pay attention. Like there's a biological reason that's contributing to that. There could be other like socioeconomic reasons, there could be cultural reasons. I'm not saying that it's the only thing, but a massive contributor to that is the fact that their head's so far forward. I mean, we live in a society where it's a major player.
Absolutely. It's the only thing that we talk about. Not the only thing, but when it comes to kids, it's all we're talking about that.
Yeah,
That's why we have running kids running around all the time because all day long, parents, and again, they're just trying to do what's best for their kid, but parents are always having the technology. They don't know. Kids looking down is, hey, there's some simple things like you said, get a stand, have them look up more, meet them where they're at, but also teach them how that now they have a choice but don't have a choice where
right.
the imprint's always already there. It's already reinforcing that forward head posture. So now it's like, what are you going to do about it as a parent? Most parents want what's best for their child, so they just don't know.
Yeah, yeah, it's true, and that's a great point. All the parents want what's best for their child. Who doesn't want that? I mean, there's no parent that's like,
Most,
I want my
there's some,
child to suffer. Yeah, yeah.
there's some,
There's
but
some.
most, right? That's why I use the word most. Is hey, not
Yeah,
everyone starts off in the same path, right? Some if you
yeah,
got to think that's another thing too is that's opened my mind too. Is when I thought that was normal in my life of how I was raised with chiropractic. I've also learned that not everyone is born and raised into a healthy family as well, right? A lot
absolutely.
of people come from trials and tribulations and learn that is that's why I also say is people don't know is I'm not going to scold you for it, but once you know, it's now your responsibility.
Absolutely. Well, you
Mhm.
want it to be. And that's what you do such a great job of communicating to people is going, hey, look, man, here's the deal. I'm gonna lead you to the water and you can drink it if you'd like. Look at all the people in this practice. These are the results of drinking this water. You know?
We use the word Kool Aid, but it's all right.
Good. Yeah, hey,
Drink the
whatever.
Kool Aid, no.
Yeah, yeah,
But the
exactly.
point that, but no, and that's the point is like that's why I said is what do we apply in our office is responsibility. You didn't know. It's not your fault. We're gonna teach you. If you want to be part of this practice, you're gonna like learn and grow. And then the idea is like if you don't want to be helped, it's your life and your family's life, not mine.
Yeah.
My family and the people in our office are living a great life and a life of health and life. And if you want to join it, awesome. I'm super excited for you and I want you to join it. I'm going to be excited and passionate. But if you don't want to do it, I could have done a better job at communicating that
Yeah, yeah. Yeah, true.
because it was something you didn't get.
Yeah.
So my fault. So I'm sorry for that one.
Yeah,
Do that
oops. Yeah. Sorry,
one
guys.
because to me
It's
it
okay.
doesn't even make sense, right? And that's
Yeah,
coming from genuinity, if that's a word, being
yeah,
genuine.
yeah, yeah, yeah.
It's like it doesn't even make sense that I just communicated what I did and you don't want to get it. So obviously I did something wrong. I got to get better.
Yeah, yeah, yeah. You gotta get totally. I mean, that's a great way to think of it. And this is what keeps you growing is questioning, putting the responsibility on yourself and go, wow, I must have not, what did I say that resulted in that outcome? this is why your practice has grown so much, is because you're constantly assessing how to get better and going, well, I mean, it's very rare to find people who are willing to do that and just go, well, I messed that up. I fucked that up for real. Like, that was my fault. And the more that I do that in my own life, the less that it happens, but it's like just being willing to get a no, like just being willing to put myself out there, being willing to be wrong, being willing to just try 8,000 times. Like, that's why we're great, is because we're willing to put in the reps and taking fear and going, okay, it's not saying that I'm not afraid. It's just saying that I value my purpose more than I value this fear. So I have to have courage in order to make this real. So now I'm just going to try it, and maybe I'll mess it up, but maybe I could just come with a bunch of energy and they won't understand, and then they can figure it out later.
Depends on the environment, whatever it calls for us. That's why the word communication is more than just speaking.
Yeah.
Right. It's everything. It's also is, what does that person need to understand it? Because not everyone understands the same way. So that's also part of the art, which is, if you want to use the word selling, part of the art is being able to communicate in a way they can understand it as well.
Right.
Yeah.
Well, dude, it's been
So
real.
Absolutely.
Yeah.
Thank you for having me up on here.
Yeah, dude, it's been a good one, man. I appreciate you making time to be on the podcast. We've had 11 people sticking with us for the last 45 minutes, half hour-ish. So
Nice.
To all of you guys, love and kisses, hearts all around.
Hearts, everyone.
It's you guys that are gonna help us progress. One day it's gonna say 11 million, and the chat's gonna be blowing up. We're gonna have to hire a bunch of people to respond to everybody. So I'm saying it now. One day.
Well, it's gonna come true now.
Yeah.
Get ready.
Yeah, it's already done. I just have to keep doing it, and then it's already gonna happen.
Absolutely, that's intention.
All
right. Thanks, all.
Yeah.